Let's talk about sexually transmitted infections. The NCLEX loves to ask about these, so let me tell you some must-know memory tricks. First, let's talk about chlamydia. The memory trick here is chlamydia, think lack of symptoms. Chlamydia is often called the silent infection because many people who have it show no symptoms. All right, now moving on to gonorrhea. Gonorrhea, think resistant to many antibiotics. Gonorrhea has developed resistance to many antibiotics over time, making it more challenging to treat. All right, next is syphilis. Syphilis, think painless ulcers. The classic symptom is the painless ulcers. You may hear this called as chancre. So please remember, syphilis, think painless. Next, let's talk about trichomoniasis. Trichomoniasis, think tricky parasite. This is a very tricky parasitic infection. Next is HPV or human papillomavirus. I would say this is one of the most tested on STIs in nursing school. So HPV, think cervical cancer. This is the most common complication of HPV. That's why vaccination against HPV is the key to prevention. Then we have group B streptococcus or GBS. GBS, think passed to baby through birth. GBS can be passed from mother to baby during childbirth, potentially causing severe infections in the newborn. So IV antibiotics are administered during labor and delivery if the mother is GBS positive. And lastly, we have herpes simplex virus or HSV. It's important to know there are two types. HSV1, which is seen on the mouth or lips. So HSV1, think oral. And HSV2 is seen on the genitals, so think HSV2, think too personal to talk about. The Complete Nursing School Bundle Edition 2025 has a new reproductive section which covers STIs, but also more topics and more memory tricks to help you in nursing school. You can find it on my shop, Nurse in the Making. Happy studying, future nurses.